Today's nursing mindset is about the immune system. When many people hear the word immunity, they immediately think about getting sick, vaccines, or white blood cells. And those are certainly part of the picture. But as nurses, we ask a different question. Is the immune system responding appropriately? Because that's really what immunity is all about. A healthy immune system protects the body from harmful invaders while recognizing the body's own healthy tissues. When that balance is maintained, the immune system is your friend. When that balance is lost, the immune system can become the problem. Let's start with what a healthy immune response looks like. When bacteria, viruses, or other pathogens enter the body, the immune system recognizes them as non-self. It responds by destroying those invaders, removing abnormal cells, and creating immune memory so the body can respond even faster the next time. That's exactly what we want: protection, healing, homeostasis. But sometimes the immune system doesn't respond enough. This is called a suppressed immune response. These patients are immunocompromised and have difficulty fighting infection. You may see this in very young children, older adults, patients receiving chemotherapy, those taking immunosuppressive medications, or individuals with certain chronic illnesses or genetic disorders. For these patients, our nursing focus is preventing infection. Hand hygiene becomes even more important. Protective precautions may be necessary. Patient education is essential. Now let's look at the opposite problem. Sometimes the immune system responds too much. This is called an exaggerated immune response. So instead of protecting the body appropriately, the immune system overreacts. Sometimes it reacts to harmless substances like pollen, pet dander, or certain foods, which can result in allergies. Other times, though, it attacks the body's own healthy tissues. These are autoimmune disorders. So instead of recognizing self versus non-self, the immune system mistakenly attacks its own cells. As nurses, we recognize that both situations represent an imbalance. One response is too little, one response is too much. Our goal is always to help support a balanced immune response whenever possible. So let's take a quick look at the major organs that make this possible. First up, bone marrow. Bone marrow makes immune cells and is where B cells mature. The thymus trains T cells. The spleen filters the blood and helps activate B cells. The tonsils and adenoids guard the entrances to the respiratory and digestive tracts, helping trap germs before they enter the body. And the appendix supports immune function and helps maintain healthy gut bacteria. Notice the pattern? Each organ has a different job, but they all work together to protect the body. Another area that often confuses students is the difference between B cells and T cells. So let's keep it simple. B cells mature in the bone marrow. Think B equals bone, like the humerus bone, for instance. B cells produce antibodies that circulate in body fluids, and this is called humoral immunity. Humerus, humoral, get it? T cells mature in the thymus. Think T equals thymus or T-mobile, if that memory trick helps you. T cells don't make antibodies. Instead, they directly attack infected or abnormal cells. So T cells, T-mobile, cellular immunity. Now let's connect this to patient care. Every time you assess a patient, ask yourself, is this patient's immune system responding appropriately? Do they have signs of infection, such as fever, chills, redness, swelling, fatigue? Or do they have signs of an exaggerated response, like hives, itching, wheezing, or swelling? Those assessment findings help guide your nursing care. Our role as nurses is to identify risk factors, promote infection prevention through good hand hygiene and vaccinations, monitor for changes, administer prescribed treatments safely, educate patients and families, and work with the healthcare team to protect immune function. Remember, our goal isn't simply to memorize immune cells or organs. Our goal is to recognize whether the immune system is helping the patient or harming the patient. That single question guides your assessment, your interventions, and your clinical judgment. Every safe nursing decision begins with the right mindset. So let's keep developing your nursing mindset.